I sleep outside. I've got nothing, and nothing to eat. For my children, I make whatever I can find. I've got 7 children, 4 big and 3 little ones. I brought the little ones with me. The others have gone off alone. It's not going to end. We're going to keep running away and coming back like this. It's our life now. All we can do is try to leave when we hear bullets. But we have no choice. We have to go back to our homes, back to our land.
Mugunga 1 camp, east of Goma. Since the town fell, the number of people in the camps has doubled. This young woman was shot during the fighting in Goma. Other wounded like her flocked to Virunga Hospital for medical assistance. As soon as the town was taken, an MSF surgeon and anesthetist came to reinforce the team already present. In addition to its activities in several large hospitals, MSF has set up mobile clinics inside the camp and continues consultations at the health center. What is important is to keep our activities going.
I think one of the things that we need to remember here in North Kivu as well, it's not just Goma, it's throughout all of the Kivus. We have 4 other projects and other agencies have evacuated due to insecurity, and it's important that we maintain our presence and to let the people of Congo know that they're not forgotten and that we're here and we're trying to help.
MSF has been working in the Kivus for over 30 years and will continue to provide free health care to victims of the conflict. Fields destroyed, homes burned. In addition to cattle raiding, the civilian population has become the target of increasingly brutal attacks. Fearing for their lives, whole communities are being forced to leave their villages. Healthcare facilities are also being targeted, so the MSF teams go to find casualties hiding in the bush, and sometimes they come across whole families who have been massacred.
It was horrible. I never seen this before in South Sudan. It was horrible that children, women, elderly people were shot, dead. One of our staff his children was all of them killed in the airstrip. They were all found. He found all his family killed in the airstrip. It was very, very, very bad. I felt so bad. I mean, I was touched. I mean, we just found people, the relative, the wife, the children was found dead on the airstrip. It's really very scary. This one is enough.
You need to keep an eye on the temperature.
For over 2 months, on foot, by car, and in dugout canoes, 3 MSF teams scoured the tropical forest to reach the Aka Pygmies, an ostracized people with no access to healthcare. To eradicate yaws in the community, a mass treatment campaign was organized and everyone was treated. A single dose of antibiotic is enough to cure the disease. In all, over 17,000 people were treated, of whom nearly 7,000 were children under the age of 15. A trailblazer, it is now time for MSF to pass on the baton.
The big question is how to follow up. Local elimination and global eradication it's not going to happen with one campaign.
First step, the World Health Organization. The YAWS team goes to WHO headquarters in Geneva to discuss the results of the campaign. After several meetings, one of the WHO representatives appears to be more determined than ever to learn from this first experience.
What MSF has demonstrated is that with determination and goodwill, you can reach the hardest to reach area. I think we are going to take lessons from what has been done and try to see, not only for yours, but in general, I will put it, how to get healthcare to populations in remote areas like that.
Worldwide, the number of people estimated to be infected with yaws is around 500,000, and all of them have virtually no access to healthcare. This cholera treatment centre is in the Carrefour district of Port-au-Prince. With its 275 beds, it is the biggest cholera facility MSF has in the country. The team saw over 450 new cases in just 1 week, a direct consequence of Hurricane Sandy. The heavy downpours have resulted in the sanitation systems overflowing, which is how most patients become infected.
My home was flooded. I had to clean up the mud, and that's how I caught cholera. I don't eat food that has gone off. There is no other explanation. My house was full of mud and rubbish. There was fecal matter too.
Here, the patients receive oral or intravenous rehydration, and the most severe cases get antibiotics. Although the Ministry of Health's response remains inadequate, many aid organizations are leaving the country. So MSF has increased the number of beds and is on standby to provide treatment to people with cholera. Tuberculosis is particularly prevalent in Chechnya because of the displacement and destruction resulting from years of conflict. Patients were often unable to get the treatment and care they needed. In addition to that, TB was often seen as a shameful disease, and people were afraid to seek treatment. Half of new cases diagnosed in Chechnya have developed drug-resistant tuberculosis, meaning that the disease is resistant to traditional drug combinations. To ensure patients adhere to treatment and to help them recover, counseling sessions are now integral to the treatment.
We need to work more on treatment adherence to help get the trust of the patients, so that they can understand how important treatment is. If they stop taking their treatment because of the stigma, it can cause even more damage. All I can do is make the patient feel comfortable and establish a relationship of trust between us. It's really important for the patient.
The counseling sessions are held at the hospital or in the patient's home. Once patients accept their illness, they will be more careful about taking their treatment, which is essential to curing tuberculosis. Since March 2012, in the Conseguela Health District, in addition to treatment, the program offers a preventive care package for all children under 2 years. Gafore Kone is 18 months old, and this is his 4th visit to the healthcare center. He's been in the program since he was born. He received all his vaccinations in his village, and then, when he was 1, he started to come for consultations. As soon as he arrives, he is weighed and measured. Then his mid-upper arm circumference is taken to detect any signs of malnutrition. The checkup finished, his mother will go to collect some pots of nutritional supplement, a fortified peanut paste rich in milk designed specifically for young children. Between the ages of 6 months and 2 years, Gafore will have a total of 5 follow-up consultations.
At that age, children are vulnerable. So if we provide the food supplement, the mosquito net, the vaccinations, 2 years later, the child is really healthy. He can continue to grow and develop without any major problems.
Both preventive and curative, the project has enabled a significant reduction in malnutrition and mortality rates. Here's what this mother has to say.
When my child turned 6 months, we went to pick up the food supplements, and he had all his vaccinations. Since then, he's been fine. He doesn't get ill. He doesn't get temperatures like my other children did.
With a participation rate of 95% and coverage of 99% for most vaccinations, the results are very promising. The program has provided care for some 4,800 children since it started 2 years ago.